After an ACL rupture, you can choose the treatment pathway most suited to your particular injury and circumstances. Treatment includes both surgical and non-surgical options. Whatever pathway you choose, the aim is to restore functional stability to the knee and return safely to your preferred activities, and importantly, reduce the risk of sustaining another ACL injury. ACL reconstruction surgery. In North America, Europe, and Australia, most ACL ruptures are treated surgically with ACL reconstruction, or ACLR. ACL reconstruction, using graft material from the patient or a donor, has been practiced for decades, is well understood, and offers reliable results. Advantages. A long history of over 40 years of results, giving a measure of outcome certainty. Other knee injuries, such as meniscal tears, can be addressed simultaneously. Disadvantages. An invasive procedure. Expensive in the private health system, or 12-month waiting list in the public health system. 15% to 30% re-rupture rate, depending on age or sport. Requires a long period of rehabilitation. Return to sport is not recommended before 12 months. Non-surgical rehabilitation. An alternative treatment option to ACL reconstruction surgery is management with exercise-based rehabilitation. A 2014 prospective cohort study found there were essentially no differences in outcomes following non-surgical and surgical treatment of ACL injury. This included knee function, strength, time, sports participation, level of sport, and re-injury rate at 2-year follow-up. Rehabilitation aims to strengthen the surrounding muscles, to provide dynamic stability to the knee, to replace the static stability of the ACL. Advantages. Non-invasive. A degree of efficacy found in clinical trials. Less expensive. Potential for ACL healing. Return to sport between 3 and 6 months, depending on damage to other structures in the knee. Surgery is still an option for those who do not get a good result. Disadvantages. Potentially an ACL deficient knee. Concern regarding not doing everything possible.